The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Every day, citizens around the country are faced with new dilemmas. Dilemmas that affect them profoundly. Whether it's injustice, discrimination, falling through the cracks, scandals and cronyism, balances of power, ethics, religious freedoms, state versus citizens, and unfunded mandates, and the list goes on and on and on. Welcome to Speak Up. It's directed at those who have fallen through the cracks, and it gives them a voice. It's your turn to speak up. To stand up and fight back.
Welcome to Speak Up. I'm Kevin Avard, your host, and today we're going to be talking about managed care and some of the potential problems that we may be facing shortly if we don't do something about it. And I have a guest today, Carolyn Virtue. I want to welcome you to the show. You're basically a senior elderly advocate.
Yes, thank you for having me, Kevin. I appreciate it.
Well, anytime. So you're an advocate for the elderly.
Yes, I am.
And what does that mean in particular?
I own a company that does case management predominantly for a group of individuals who are eligible for nursing home care, but they choose to remain in the community. And, you know, on any occasion when I become aware of somebody who is having difficulty exercising their access to that option, I will assist them in accessing the care they need.
So people that potentially have fallen through the cracks, they need some help, they don't know where to turn. You're an advocate that helps them through this whole process.
Yes.
Now, you were on Channel 9 not too long ago. Basically, you were talking about Doris B.
Yes.
What was all that about?
Doris is an elderly woman who lives in the Lakes region. Mm-hmm. She had been receiving services to maintain her in the community in lieu of nursing home placement. And New Hampshire Department of Health and Human Services decided that she had improved to a degree where she did not need the services.
And she was how old?
92.
Wow.
Yeah.
But that really wasn't the case.
No, that was not the case. So I worked with her to get her situation known so that there was some attention on it, because I was not successful in resolving the access to care issue that she was experiencing with the Department of Health and Human Services.
So you got it known, you brought it on Channel 9, and did things improve?
Yes, they did. The following week, the department not only restored Doris's services, but they restored services to 12 other individuals as well.
That were in the same type of risk?
Yes, and in the
just
same
like that.
situation. Just like that. They saw that it was not sensical to remove services from a very elderly individual, and you know, she clearly could not have maintained herself independently in the community.
Right.
So without the really relatively minimal supports that she was receiving in the community, she would have required nursing home placement.
Which is far more expensive.
Far more expensive.
On the county and the whole 9 yards. It's not practical.
It's not practical.
Right.
No.
You know, I think I saw you at another event at the Capitol. You were having a press conference, and it was well attended. And that was with regard to, I was taking
the budget.
The budget.
And the provider payments to the community-based care providers. the providers, the home care providers, the case management providers, the adult medical day care providers have been underfunded for quite some time. And one of the problems is that when the legislature has added additional funds to those lines, the department has failed to pay the providers the increased rates. So the Senate is like, here's your raise, and the department's like, yeah, well, we're not giving you that.
And that's really happening, isn't it?
Yes.
So one of the things that was brought to my attention was this little phrase called, and then we'll get into a little bit more of what we're going to be talking about today, is these clusters. Clusters, they receive federal grants and these monies go into clusters. And this cluster, say, Independent Living Foundation, those people that want to stay home, and, a nurse comes in, takes care of you, or, and they take you out of bed, clean you up, put you in front of the computer, or help you with your things that you can't physically do. And then they leave, and they come back at another time. They're part of a federal grant that was given to them, correct?
There are a couple of those that I'm aware of.
Right.
I believe you're referring to like the Balancing Incentive Program.
Yes.
Was federal money that came into the state.
And that money seems to go into what is called a cluster. And then another organization gets clustered with that one, and another one gets clustered. So it just kind of gets into this ball of here's this federal money, and some of it trickles to where it's supposed to go, but not all of it.
Yes.
Is that what's happening in with some of our people that need critical care?
I think that does impact it.
Yeah.
Because let's take, for instance, they call it BIP,
Yeah.
Balancing Incentive Program. The federal government gave that money to states to balance their long-term care system. So right now in New Hampshire, the majority of people consuming long-term care are in facilities, whether they be private facilities or county facilities.
Right.
And the Balancing Incentive Program was intended to, facilitate a shift in those numbers.
So not everybody's just carrying the full burden.
Right. So for the long-term care population, specifically the elderly and chronically ill portion of that population, while we were taking in those millions of dollars from the federal government, our numbers went in the other direction. So nursing home went up slightly, and community-based care stayed level. So that is a problem.
Okay. And that's actually a big problem.
I think so.
Right, especially with our senior age increasing, our population is increasing, and over the next 7 years, we probably have a situation where it could be out of control based upon the numbers that are coming in. We're going to be talking about managed care today, correct?
We are.
Tell me what's going on with managed care.
The department is moving into the next phase, if you will, of managed care, where they are going to take specific populations, including
Senior populations, right?
there are a variety of populations. I'm going to speak to the senior
Okay.
populations.
Yep.
Yes. So they're also taking developmental disability population, acquired brain injury population, and the elderly and adult, the people receiving elderly and adult services in the community. And the nursing home population as well is supposed to go into to managed care, but farther down the phases. But the contracts that were just passed by the Executive Council do include all of the long-term care populations.
Now, was it passed unanimously by the Executive Council?
It was not.
Senator Wheeler didn't, and
I know Senator Wheeler didn't, but there was another, Councilman Wheeler didn't. And
I apologize. I said Senator.
Yeah.
Councilor Wheeler.
there was
There was another one.
Another one.
There was at least two.
I think it might have been Counselor Kenny.
But they had some objections to this, correct?
Yes, they
Yeah.
did.
And that's some of the things that we're going to be addressing.
Addressing
Yeah.
today.
So,
yes.
So all these people are being shifted. What's going on? What's the problem?
The problem is that the department isn't ready.
The Department of Health and Human Services?
Yeah, they are not ready to move these populations into a managed care system.
And what? Why?
Because they don't have the appropriate safeguards in the contract to sustain our elders that are in the community.
So, what would be one of the first safeguards that are being dropped?
One of the first safeguards is, right now, all of these individuals have a case manager that is the go-to person. They're the glue that holds the menu of services together for that individual. Those people, so right now, the target date to implement the contract is January 1,
2016.
2016. The contract says that the department has until January, 5 days out, so January 5th, to assign a care coordinator.
Okay.
So that person is without a contact in the community for 5 days. That's unacceptable. Then the contract goes on to say that the care manager that's assigned has to see them by a March date. So you don't have a face-to-face assessment to that individual for almost 3 months. A lot of these people that are very elderly and very compromised are not even gonna understand that first contact. They're either, they'll send out a letter, make a telephone call, somebody leaves a message, and you're talking about an elderly, compromised population. So there's not a good plan to reach out to these people and provide, consistency.
A bridge in between.
A bridge.
And so they're just going to be standing, they'll be in limbo. How many people are we talking about here?
About 2,500
Across the state?
across the state, plus, but around that number. And
So really, what's going to happen to them, though? If they're not going to have a caseworker or somebody that helps them through this process, I don't understand. What will happen to them? They're just going to be living in their environment without somebody taking care of them?
for at least some period, the way the contract currently reads, yes.
That's not.
Right.
That isn't acceptable. So
No, because let's say on January 2nd, they lose heat. That's
who do they
not-
call?
I don't know. Contract doesn't,
Traditionally, who would they call?
their case manager.
And their case manager is actually going to be taken off the case, if you will. It's going to be redirected into somebody else 5 days after or within a 5-day period, correct?
Yes, that's the current plan.
And then from that 5-day period, there'll be until March, there'll be another caseworker? Or they'll be moving into another, I don't know what.
Right. Well, and that's one of the problems. I don't know what either, because the contract is not specific about that. What is specific is the case management as it exists today will be gone. And then the MCOs will be providing a service called care coordination. And it doesn't specify what that is or what that looks like, but it does specify that that will be 5 days in getting assigned and until a March date coming up to speed.
I'm sure the executive council must have known this as they voted on this at some point. Some of these questions must have come up.
They did come up during the executive council session, and the commissioner made, and I'm grossly paraphrasing, some sort of an assurance that the department would work on these problems and possibly make amendments. So it's important that people are aware that these gaps and safeguards are out there, so that we are on top of keeping them to the promises that were made to get the contract passed.
So anybody who's watching the show right now, if they have a caseworker, they're potentially going to be affected by this new change that's going to be effective January 1st.
Yes.
Okay, if they're in managed care.
No, they're not in managed care.
They're not in,
right now.
but they're going to
They're
be
in,
moved into the managed care.
if they're in long-term care.
Okay.
If they're receiving long-term care services, they will be impacted by step 2 of managed care.
So one of these safeguards is removed. Are there other safeguards or other areas that are of concern?
There are a number of areas of concern. Another issue that's a huge concern is that the drug formulary and prescription drug benefit is being moved from the state to managed care. So
Does that follow the caseworker? Or is there a caseworker that manages that as well? Or how does that work? Somebody's obviously taking care of their meds at this particular time. That would be the caseworker, correct?
Sometimes, yes.
But somebody's...
the caseworker would be responsible for making sure that they're getting the meds that they need.
Mm-hmm.
And then there's probably a nurse in there from a home care that's managing the meds. But if she can't get the meds and there's no one to work out a coverage issue, then she has no meds to manage or to give the individual.
Not to create a panic, but this is serious stuff if these details are not worked out, correct?
It's very serious. It's very serious. We have people that, if these details are not worked out, we have people in the community who will be at risk.
Serious risk, obviously.
Serious risk. It's very serious because you have very compromised individuals who qualify for nursing home placement, who are living in the community, many times alone, all by themselves. Mm-hmm. And you're going to remove part of the infrastructure that's keeping them in place.
This is a big change, and they're not ready for it.
It's a big change, and I certainly do not believe they are ready for it.
Is anybody else talking about this?
There are a number of groups that are talking about this and trying to effectuate positive changes to make sure the appropriate safeguards are in place. Several members of the Medical Care Advisory Committee are aware of the problems and working to resolve them.
January is not that far away.
No, it's not. The contract has a hard and fast January 1 date. Mm-hmm. The department is saying that that's not set in stone, that it might be later, but that's not what the contract says. So that's another one of the issues, is conflicting information.
Well, that's the Department of Bureaucracy for you. So we have caseworkers. We have basically being shifted onto the managed care, whatever. You get that 5-day window period. We have the medicine. We're not sure how that's going to be covered, or if they're going to get it, or if the heat's shut off. What else?
There are issues with the staffing ratios in the contract. They differ from what is being done presently. There is language in the contract right now, targeted case management, which is a recognized service under the federal government. It's an actual service that the current system is providing. It's all provided by organizations that are conflict-free. So the current system of case managers, those individuals have no obligation to anyone but the client. So they are conflict-free. They do not work for someone who's paying the bill. So the new contract says that the care managers, or the care coordinators is what they're calling it, have to be conflict-free. But the contract is not clear if those individuals can be employees of the MCOs. There's nothing that prohibits it from being employees of the MCOs. And
the MCO is?
The managed care organization. So basically you could have a care coordinator that is responsible for safeguarding the client and an employee of the person with a fiduciary responsibility to the client. So they're responsible for managing the client's budget and keeping that profitable for the company, and making sure the client has what they need. So the contract does not clearly define how that conflict, that's a conflict of interest that doesn't exist now. So there's no language in the contract that says how they're going to mitigate that conflict.
Was there
just
language,
that it will be mitigated somehow.
Was there language before?
Yeah, you have to be conflict-free now.
Is anybody reading this stuff? Is anybody following through with this? That's signing the contract?
That's signing. No, well, that's one of the questions. It doesn't seem that they are.
Wow. So basically, somebody who's taking care of somebody, and their finances might have a fiduciary interest also in making sure that that money goes to their employer or themselves or whatever.
Right. So Doris B., who now has one of my case managers going in there to protect her interest, will now have somebody from the HMO that's also going to be responsible for the reimbursement end of it. So the question that is not answered is, how are they protecting Doris in that equation?
So that whatever finances that she does have is not going to be totally bled out to the company that they're working for.
Right.
What takes away that incentive? That's awful.
Right. The other incentive issue that we have here is, as the contract exists right now, the community-based care piece services go into the HMOs on January 1. The nursing homes go in at some later date that is not yet specified. So take an individual like Doris. She's goes into managed care, and the managed care company on January 1 has to start paying for her long-term care services. So whatever supports she's receiving in the community out of their monthly amount for Doris. If Doris goes to a nursing home, the managed care companies, as it currently stands, get to keep the reimbursement for Doris, and the state will start paying for her long-term care services. So as it is set up right now, the incentive to keep somebody in the community
is not there.
And
Whoa.
the elder rights advocates really have an issue with the long-term care services being separated. We need to keep them together.
Wait a minute. So if I understand correctly, then the HMO has an incentive to collect the money, but not to provide services, and so that the state will take care of it if the person is put into a full-term nursing home.
That's right.
And they have a potential employee that will be working for them that also has a fiduciary interest in making sure that that happens,
Yes.
basically. And there's nobody going to be taking care of their potential drugs for at least a short period of time if something happens within that 5-day period. And the people that all this is being affected probably don't know these changes are coming because they haven't been told at this point so far. Am I following you correctly?
Yeah, they have sent out a couple of letters,
And
but
the governor signed this?
I believe that's how it works, yes.
Did she understand this is happening to these seniors?
I don't have firsthand knowledge of
This-
what the governor knows, but I would think she would have to know.
On a very elemental level, this is almost diabolical. It's a windfall for somebody, and the people that need the care are going to be left out,
Yeah.
or potentially harmed without these particular safeguards. Am I reading you correctly on
Yes, and I'm not saying that the HMOs are going
No, but
to
they've
do this.
They've
All
set
I'm
up a
saying
system where
is
that could happen.
the safeguards are not in place to prevent it.
And in today's economy, in today's light, bad things happen to people that they can't defend themselves.
Yes.
So that in itself is enough to get public interest. And is Channel 9 doing something about this, or is NH1 talking about this at all? Not throwing anybody under the bus.
I think they
but I'm
will
just-
be.
Yeah. Excuse me. That's pretty serious.
Yeah.
What else is going on? Obviously, there's a number of, I've got a number of sheets here. So
Yeah. One of the other things that is going on is part of the long-term care continuum is another group of care. So you have the community-based care, you have the nursing home care, then you have the residential care, which is basically small facilities. So it's, they vary in size from just a couple of beds to, up to 20 or 30 beds. And they are licensed as residential care homes, and it is a community placement.
McCurley's used to have a few of those years back. Now I think it's Genesis now, but
Yeah.
they look like a little house, actually.
Exactly. And a lot of, families operate them in the state now and actually live in the house and take care of the people. It's not it's like a step, it's not, the people require the same amount of care. But it's not as institutionalized as a nursing home. It's a community setting. There are safeguards missing for those individuals as well, and there's some very concerning language in the contract about how and when those people can be transferred from that facility.
To maybe a long-term care or another type of facility?
Yeah.
Yeah.
That they would have to be moved.
Is there an incentive to move them into, would there prevent them from going if they don't need to go into long-term care? Is that what we're talking about?
The contract appears to allow an MCO to force a change of residence. So is basically
Whereas before they couldn't.
no, the state couldn't.
Can't do that.
No, but it appears as if the MCO might be able to do that.
And they would have a fiduciary interest in doing so, potentially.
Potentially. Well, especially if we don't bring the nursing home in with the residential care.
Are there any companies that are, this might be the dumb question of the night, but these are private organizations that are benefiting from this, if the HMOs or?
The HMOs, I'm not very familiar with the structure of the companies. I have like a high level knowledge of the structure. One of the MCOs is a private company. The other one is a nonprofit.
Okay, but they can still profit.
I mean, right, well, that nonprofit tax status in healthcare is very misleading.
Yeah.
So basically, one of them gets tax benefits, the other one doesn't. But I'm sure they both operate.
And they have a
bottom line.
fiduciary interest in sending people into the long-term care or moving them from one, not necessarily in the interest of that particular person. And how would they fight that? I don't want to go. I like it here. I'm fine.
Well, they have to, once we move into the managed care model, they have to fight it in that system to begin with, before they can move on to the state appeals process.
And what is that appeals process all about?
The MCOs or the state?
MCOs.
I think they're, can't be an expert in anything, so I haven't really read the appeals part of the MCO contracts, but I don't know how well that's
And that would be
defined.
something where you would come in to help with an appeal, correct? If somebody said, hey, look, I'm fine. I want to be here. I like it here. You would be their advocate.
Yeah, I do
Traditional.
that now.
Right.
We help people through appeals at the state level all the time. I don't know what that would look like under managed care. I think it would be the managed care coordinator who would be responsible to help the client go after the managed care company that they work for. I think that's how the contract is written.
You can't make this up.
No, you really can't.
And are there other organizations like yourself that actually are as worried? Because you look very worried. And as you're explaining it to me and as I'm understanding it, if I understand it correctly, there are a lot of, I get it. These people are at risk, and it's at our own doing. It's at the state's own doing. And they're creating a system where private and nonprofit organizations can actually profit from their demise by putting them into an institution, number one,
Yeah.
that not necessarily good for them, nor for the people, nor for the state having to pay for it. On top of that, they're not being told. Are they being told? Are they being educated as to what's going to be happening in the next 4 months, 3 months?
The collective they,
Yeah.
do you mean? I think there are a number of people who myself included, who are, attempting to do so. But, the way that this whole process was rolled out, they issued the 800-page contract and then, pushed it through GNC less than 2 weeks later. That's a lengthy document to get through in that time frame. I think everybody involved did the best they could to respond to it in the time frame that they had. But, it's not like you can go out and rally the troops in that time period.
Do people, this population of 2,500 or so, are they all in contact with people like yourself to help them, or do they know about your type of organization that helps?
Yes, right now they are. And one of the problems, if you will, of getting these people to storm the State House, to say, hey, don't let this happen.
They need somebody to help them.
Is
Bring them out
that
there.
there's no transportation for them to get there, number one. Transportation is a huge issue. There's no social transportation in the CFI waiver anymore.
Explain what
the-
CFI is.
Choices for Independence, it's the name of the waiver that we're talking about, the community-based care waiver. So that's the program that the people who are in the community are on. A lot of them are very elderly, live alone, and don't leave their house. You can't call that individual and say, hey, you're going to lose all your services if you don't get yourself down to Concord.
And yet at the same time, you don't want to throw a panic, but this is
Right.
this is going forward.
Right. As
This
of
is-
right now, it's going forward.
And the communities are statewide. Where's the majority of the communities? Do you know?
It's statewide.
Okay.
Yeah,
is
all communities are impacted.
just completely spread across. There
Yeah.
isn't a cluster in Manchester or Nashua, or they're everywhere.
North Country, Yep, it's the whole state. But, you know, one of the other big problems with this is that it's really hard to educate the whole house. You know, and they are
There's 400 of them.
yeah, the you know, decision makers, if you will, for the first part of the process.
What would you want them to do?
I would want them, you want my dream
Yes,
list right now?
I do.
Today? Yeah. I think that when they come back, I think actually they should have a special session and throw the brakes on this before January 1 and make sure that you know, if they are going to move this very specialized population into the managed care model, that they need to make sure the appropriate safeguards are in place to do so.
So I understand the safeguard part of it, and the people are being put at risk unnecessarily.
I believe that's true.
Totally
yes.
see that. No, it's just dawning on me. Well, if these companies have the incentive to move these people into, I keep going back to that because, you know, hey, somebody wants their bottom line, you know, and you work for me, you know, does she really need to go to the nursing home, right? I mean, that happens. That's human nature. That aside, they collect money that was designated for these particular individuals, right? That's what you said earlier?
The MCO.
Yeah.
Yes.
And then if that person is moved into a nursing home, they're still getting their money. Now the state has to fork out more money to an even more expensive care
Yes.
with these people, driving up the cost exponentially.
Yeah.
Right? And some counties will have to absorb these costs because, and then of course there's the limited beds at this particular time. I mean, they're almost maxed from what I understand.
Yeah.
That's going to drive the county budget up. That means the property taxes are obviously going to go up. You know.
Yeah.
This is a nightmare, a potential nightmare for everybody, not just
Right.
for the people at risk, but the people that are the taxpayers.
Well, on the taxpayer side of the issue, what we really need to look at, this managed care model was sold to the citizens of New Hampshire on the basis
That's going to save money.
that it was going to save money. That hasn't happened. So why are we still moving forward?
Because some people are very stubborn, in my opinion. Wow. What else is
And
it?
on the financial side with the prescription benefit, so let's say it's okay if people lose access to drugs, there is a big question surrounding if the state's going to lose money by coming out of the compact that it's in with the other states. And I don't believe that question has been adequately answered to anyone's satisfaction yet. So this whole thing is just, you know,
Well, would you rather have the legislature put a moratorium on this contract of some sort until if they can do that?
Step two. I think there are a number of ways that people can work on that. I think, yes, if the legislature came in and said, you know, we need to make sure
That these safeguards are put
that
in
these
place.
safeguards are in place, I think that would be very helpful. I think if they came in and really looked at whether or not they've realized the savings that they promised they were going to realize, I think that's another question that needs to be fully investigated and answered. But there are a number of other things that have to happen before the department can move forward with step two. And one of those things is that they have to get a waiver, a 1915C waiver that requires a public input process. And I think people should weigh in on that waiver.
And how would they do that if they can't get there?
I know. Well, they haven't released what the process is going to be, but certainly I think the advocates are going to try to reach out to consumers
How many advocates are out there?
in the state of New Hampshire right now. I think there are quite a few. The bigger question is how organized they are, and I think the answer to that is not organized enough.
Well, there was you had a press conference, and that obviously had to do with this as well.
And we had very good attendance
Right.
at that. But a number of people worked very hard to make that happen. And I think a lot of those people are committed to doing that moving forward. So I think, I think people are going to try to move the needle on this. I think there's a high level of concern.
With a number of people.
Yeah.
If you wanted to make an appeal to the people, citizens of New Hampshire, you got a 3-minute. What would you say? You obviously spelled out there's some safeguards that are missing. That this isn't necessarily going to save the taxpayers or anybody any money. There's obviously an incentive, whether intentionally or unintentionally, to move people into long-term care, whether it's good for them or not. I mean, whether they've just opened up that door to allow that to happen against their will. There's a situation where people might not get their prescriptions. We know how critical that is.
Yeah.
We don't know if the cost of their prescriptions are going to go up or down based upon a number of other factors. Nobody's being helped along with this process as this moves forward, if we want to call it moving forward anymore. What is your appeal?
My appeal would be to the well elderly, the well middle-aged people who think of this as someone else's problem. My appeal to those people, because those are the people that we need to help us, and those are the people that we do not have now. My appeal to those people would be, you are a diagnosis away from long-term care. Nobody believes that.
Disability,
Yeah.
so at some level, some sort. I used to sell insurance. It affects everybody. And
This is not somebody else's problem. This could be your problem much quicker than you realize.
in 10 years
And-
goes like this. 15
Yeah.
years goes like this.
And those are the people that we need at the table. So I would urge them to get involved.
And if you have a parent that's going to be placed in elder care, or you have a family member or somebody, it's time to take a sober look at this.
Yeah, and get involved.
And how do you get involved?
You can get involved through AARP. There's another group called the Elder Rights Coalition that not only welcomes but seeks out community members.
Call your legislator.
Call your legislator, call your executive counselor.
I submit to you that the emails do work as long as they're not carbon copied and pasted.
Yes.
We see those. I'm senator, I get it. When I see individuals that has more, if there's a 2-second line, has more impact with me as a senator than something that's been carbon copied 50 times.
Yeah.
It really does. So email all your senators, email all your legislators. This is a problem. We need to take care of it. Stop this process or put a moratorium until these situations are rectified at some point. So
You're absolutely right, because there's no question that if given the choice, people will choose community-based care. And those are the people that we need to come forward, because this system is, we used to have a very strong community-based care provider system in New Hampshire, and it is beginning to crumble. for a whole host of reasons, but we've lost several providers just this summer who have said we are not serving the Medicaid population anymore.
Who are the providers? What do you mean by providers?
We lost the
Not necessarily. What are the private?
home care providers, adult medical daycare centers have closed. Personal care providers, we've lost a couple of those. So, we've lost a number of hands-on caregivers.
Institutions are not a good thing.
Yeah. Well, and it's expensive.
Yeah.
And, the other thing is, let's play devil's advocate here and say that an institutional model is the model that we want. You better start investing in that infrastructure because we don't have the beds. So, we're moving forward like it's institutional care that we want, but we have a moratorium on beds.
Because of the certificate of need?
Right. So what we're really choosing is no care, which as a society is reprehensible.
So the certificate of need is basically something that stops anybody, if you're a private organization and you want to come into New Hampshire and build a number of beds, the certificate of need stops that. It's supposed to end. It's supposed to end 2016, but I know Franklin recently asked for a waiver from the certificate of need so that they could provide new beds. But it kind of went down in flames, and one of the senators that I had issue with, we were talking about it on the floor, and I said, we need to get rid of the certificate of need. But Senator Avard, that'll have a problem because then we'll usher in this free market thing. I was baffled. What do you mean? Well, they're protecting certain organizations, but not allowing more beds to come in, and there are going to be needing more beds soon enough. Franklin's already asking for waivers. So that's an issue. We got to free up the market to provide these services. The state doesn't seem to have a good track record when it comes to doing anything. I forget it.
No, but you're right.
But anyway, so how can people contact you for more information about this?
People could email me or call
What's your email?
CVIRTUE at heritagecasemgt.com.
Okay, I'm sure we probably have it on the screen.
You do.
And you are, again, an elderly advocate. And if not you, contact somebody, another advocate that's out there. The other organization that you said was AARP, there was another one.
The Elder Rights Coalition. There are other case management companies like...
If you have a parent that needs care, or if you have somebody or a relative or a friend that has a disability, get involved. They need it.
Yep.
So thank you for coming on the show and bringing
Thank you so much for having me. It was really a pleasure to talk to you. I enjoyed it.
Thank you. Thank you for watching Speak Up. If you have an individual in your life, a family relative, or somebody that you know that needs long-term care or that is in community care or that has a caseworker, please contact your legislator. Tell them your concerns. Find an advocate to help them through this process. This is something that's going to affect these people profoundly if nothing is done. If these safeguards are not put in place, then we have a bigger problem on our hands. So until next week, thanks for watching Speak Up. We'll see you. Thank you for watching Speak Up. And we want to thank our sponsor, Avard Cleaning. If you have a carpet job, call Avard. They're the best in town. And if you have a story and you want to be heard, contact me, Kevin Avard, at speakupnh@gmail.com. That's speakupnh@gmail.com. We'll get your voice heard. Thanks for watching. Until next week.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.